I've always exercised, so that's part of it, but I was always overweight exercising. I love comfort food, and that's what kind of led me to this issue. I was 53 years old, 8 years ago. I had my first heart event, if you will, and went to the cardiologist and went through a series of tests, ending up with a heart catheterization, my first of 5 heart catheterizations. And in that procedure, I was found to have a 4-centimeter blockage in the widowmaker, which I had miraculously bypassed with collaterals. It's not unheard of, but it's rare. On Easter Sunday morning, I passed out and fell out of bed and broke a rib. And in a local hospital, I was run through a series of tests in the emergency room, including an EKG and things of that nature. And they basically said to me, what you have in your history is what's going on. You broke a rib, there's nothing else. So my wife and I were watching local Channel 4, the NBC affiliate here, and there was a program on the heart hospital at Ohio State. And it was intriguing. I mean, we really enjoyed it. It was a couple of hours long, and basically at the end of that, my wife and I got on the internet and started looking for cardiologists that worked for Ohio State Medical Center. And went in and had tests that I had not had in the prior 4 years with the other medical organization. And the phone rings, and my cell phone, and he said to me, "You are the worst case we've seen in a long time." So they took me right in for a heart catheterization. And at the end of the heart catheterization, and that was Dr. Mezzaferi, who conducted that procedure. He got together with Dr. Abraham and with the cardiologist that had done the work for me at CarePoint Gahanna, and they talked about what they were seeing. And Dr. Mezzaferi came over to me and he apologized because catheterization, the type of work that he did, was not enough to do what needed to be done. And I was going to need open heart surgery. I have lost a total of 70 pounds since my open heart surgery, and right now I weigh pretty much what I did when I was 16 years old in high school, but I'm in much better shape physically in terms of my muscle tone, etc. And I feel great. It had gotten to the point 5 years ago where I was told not to pick up more than 25 pounds, not to go out in weather below 30 degrees or above 80 degrees. I did put together a paver patio in the backyard, okay? And basically did the digging, went and got the aggregate, 50 pounds a bag, 16 bags, 50 pounds a bag, went and got it and wheeled it around to the backyard and got the sand and all of that stuff and was able to put in, literally in 2 days, it's only 50 square feet, but it's right on the edge of the creek that's right behind me. That's something I would not have even attempted. I mean, 5 years ago, that would have killed me. The quality of life with my grandchildren, I mean, that's just, priceless. Without Ohio State, without Dr. Abraham, none of that. I would encourage others to give to the Ross Heart Hospital, of their time and their talent and their treasure, simply because it's all about life. Just being able to live, number one, which is not a given, and then to have a quality of life, okay, that allows you to participate with your grandchildren. Get out in the backyard and run around with them, play some soccer, as opposed to being stuck on a couch watching TV because you have heart failure and you're on this downward spiral. Getting involved in an organization like Ohio State with the state-of-the-art doctors, equipment, the fabulous personnel that are there, gives you an opportunity to take advantage of all the latest and greatest advances in medical science. I'd recommend getting involved any way that you can, because at any time it can happen to you. They deserve your volunteerism, they deserve your contributions, they deserve your taking advantage of the opportunities that they provide for medical care for you and your loved ones.